Contraception or birth control is the topic that has gained traction in recent years. It is a fundamental aspect of reproductive health and family planning, empowering individuals and couples to make conscious decisions about the timing and spacing of their children. The history of contraception spans millennia, with methods ranging from ancient herbal concussion and barrier methods to the more sophisticated hormonal and long-acting reversible contraceptives available today. The development and widespread adoption of modern contraception have had profound impact on the society, influencing women's health, education, economic independence, and family dynamics. In this video, we'll look at the various options and help you decide which suits you or the state you are in. But first, what exactly is contraception? Contraception is the use of methods or devices to prevent pregnancy. Today, we focus on the most common devices and how they work. The mechanism by which they prevent pregnancy is in three main ways, and we will review them as we go through each type. The type of contraception that requires devices will include the barrier method, the hormonal method, and the intrauterine device method. The barrier method comes in forms such as the male condom, the female condom, diaphragm, and cervical caps. They act or work by creating a blockade, thus preventing the male's gamete or spermatozoa from entering the female reproductive tract for conception. This creates several advantages, however not without its downsides. The advantages here will include that it is readily available, easy to use following minimal training, the side effect is significantly minimal. Also, condoms are the only form of contraception that prevent the transmission of sexually transmitted infections. And lastly, they are cost-effective over all other devices. The key downsides to consider will be looked under this following heading. Effectiveness. Barrier methods have the highest failure rate of all contraceptive devices, with about 15 to 18% of people becoming pregnant in the first year with typical use of these methods. This is often due to factors like improper usage or breakage. Another is allergic reaction, as some people can experience allergic reaction or vaginal irritation resulting from substance from which they are made from. And finally is satisfaction, which is usually low due to a reduced sensation and occasional discomfort from the forms available under this method. Hormonal method comes in many forms like the pills, implants, injections, or patches. The hormonal method works by using synthetic versions of hormones like the estrogen and progesterone. These hormones suppress ovulation as they dampen the effect of the luteinizing hormone and the follicle-stimulating hormone, which controls ovulation. They also cause thickening of the cervical mucus to block sperm, as well as thinning of the endometrial lining of the uterus to prevent fertilized egg from implanting. Let's look into them one after the other. The pills are of two types. We have the progestin-only pills, also known as the mini pills, contain only progesterone or pregnancy hormone analog like the norgestrel and the norethindrone. The combined oral contraceptive, on the other hand, contain both estrogen and progesterone hormone analog. The mini pills are most suitable for breastfeeding mothers and adolescents, especially those who experience or have contraindications to estrogen use. The pros of using pills here will include that it reduces the risk of certain gynecological cancers, particularly the combined oral contraceptive. There's also a reduction in dysmenorrhea and premenstrual syndrome symptoms. And infertility returns immediately upon discontinuation of the pills. Some of the disadvantages to consider is that although it is twice more effective than the barrier method, with an effectiveness rate of 4 to 7%, The rate is still poor, especially given the fact that the effectiveness is largely dependent on compliance with daily drug use, as forgetting even one can significantly affect the chances of pregnancy prevention. Another is, unscheduled bleeding may be a common occurrence with the menopause. Breast tenderness and occasional headaches can also be a common theme. Other potential side effects will include mood swings and weight changes. If you have found this video enlightening thus far, kindly like the video and subscribe to our channel. Done that? Now let's get back to the video.